Good evening and namaskar everybody. So this video we are going to answer a lot of things about chin augmentation. So you may want to hang around and see what we are going to tell you about the different aspects of chin augmentation. We decided to take one topic at a time, and as you already know, Dr. Priya is here. She's got a list of frequently asked questions and she's going to shoot them to me, and I'm going to try and make it as simple as it can be, so you all can understand what we mean by certain terminologies. Now, chin augmentation is simply said that you augment the chin, you make it bigger. Mostly done in the horizontal dimension, but can also be done in the vertical dimension. That is, in layman's term, what is called as chin augmentation. Right? So now, do you have some other questions I start off with?
Yes. Thank you, doctor. You gave a brief introduction about chin augmentation, and it's very commonly asked by patients. The first question comes as to who is an ideal candidate for chin augmentation?
Very, very commonly asked question, and it's very hard for me to say in one word because a lot of people do actually benefit from chin augmentation. Now, chin augmentation, before I get into who will benefit it, I think I want to tell you a little bit about the types of it, because then that's going to clarify the next answer. So the main osteotomy, one of the main ways we do it is osteotomy. The other ways we do it is with an implant. So we've got 4 implants lined up here, if you can see, slightly bigger size silicone implants. All of these, the different types, different shapes. Now these are called as onlay chin augmentation. This is the lower jaw and this is the chin. So these implants are put like this. They are sitting over the lower jaw. That's all it does. This is one form of chin augmentation. The other form of chin augmentation, which I refer to as a more permanent, lifelong, stable chin augmentation, is via bony chin augmentation or a genioplasty. Many varieties are there, many types are there, but to understand, this part of the bone is cut with an osteotomy, or it's cut through and through, it's moved forward and fixed with plates and screws. That's the second form. There's a third form as well, which is a temporary chin augmentation, where you get fillers done here. That could be there for a few months to max a year, then that would disappear. So you have a temporary and a permanent chin augmentation. In the permanent chin augmentation, I just mentioned 2 different ways. You could also use some other material like PEEK or Medport, doesn't matter. We have silicone here for you, different sizes available. Similarly, different forms of genioplasty, different forms of mentoplasty, different forms of bony chin augmentation also available for us. Now, I will also tell you one big difference between both of these. Very often these are placed through a small cut here, and the genioplasty or chin bony augmentation is done from inside the mouth. So this is the overview about the chin augmentation. And now, to answer this question as to who needs it, I think anti-face is in vogue. A strong personality means you got to have a strong chin. Look at the movies, look at people around. I think this is something that's really in vogue right now. People do want to have a strong lower third of the face. Upper third, middle third, lower third. A strong lower third, the maximum importance is given to the chin, of course, to the ramus or the angle as well. So therefore, an anti-face always helps. I always say that a strong personality goes with a strong chin. So there you go. A lot of people will benefit from a chin augmentation procedure. Now, it's also a functional solution for a small subgroup of patients. Patients who have breathing issues, patients who have snoring of some sort, and patients who are having sleep disturbances. This bony chin augmentation does help. Of course, we have to do MRI dynamic sleep study, blah, blah, some other studies before we can say that this is a procedure for you. But there is a clearly defined, time-tested, literature-proven procedure that can be done with chin augmentation. So you're looking at a functional chin augmentation and a cosmetic chin augmentation now. Cosmetic chin augmentation is these. You don't have any functional benefit with this. but with the bony one, you do have a functional improvement as well. Now, coming to this question again as to who really benefits from a chin augmentation, let me start with the age group. Of course, both men and women benefit. Age group, age no bar, literally. You're 17 or 18 and above, you're a good candidate for chin augmentation. You're in your mid 50s, you're in your 40s, and you see that you have a double chin, there's jowl, there's hanging skin everywhere. Yes, I know everyone gets a facelift done. Yes, of course, that's a solution. But when you have an issue with a receding mandible, you can also address the same with a bony genioplasty, which I think is, I would call it like a reverse facelift. It works longer in terms of the results for the patient, and it's also beneficial, as I mentioned, the functional aspects. So the age group, a vast group of people can benefit. I said both men and women can benefit. So really, if you want to know if you would benefit, you must send in your pictures to us, preferably the side views. We also need to take scans, CBCTs, lat caps, but then we give you an idea whether this procedure might benefit you. I hope I answered that, right?
Yes, sir. Okay, so there's an ongoing debate about genioplasty, or so as to say bony chin augmentation versus chin implants. What are the basic differences between the two? If you would like to throw some light on that.
Yeah, I already answered this even before you asked me, because people keep asking me. So they're in front of you. One, we're using a foreign material, that is the chin augmentation via doing materials, either silicone, medport or PEEK3 to name. But the bony chin augmentation, we're going to cut the patient's bone and get it forward. We also use plates and screws there. Those are the main differences. The real big difference is the skill sets are side of different. One, you need to work on bone, a little bit of soft tissue. Another one, you don't work on the bone. The other difference is with a bony genioplasty or a chin augmentation by doing the bone, there is precise control and you can achieve increase in vertical height, increase in horizontal height. You can extend the cut really back or front, make the chin pointy, make the chin broad. Multiple options are there. It's actually so many more options, like basically sculpting. And that's the reason I tend to use the word genioplasty and jaw sculpting together, or chin augmentation with jaw sculpting, because you got to sculpt the bone to get the eventual result for the patient, not just a cut. So this sculpting forms an integral part of the bony chin augmentation. So these are the basic differences. When it comes to patient's healing, this is quicker, takes a day or two. This is longer, takes a week. Full healing, this would take a month, and this would take about 4 months, give or take a month. So again, you have the idea about that costing. This is going to be cheaper, this is going to be more expensive, but this is going to be more permanent, safer, long lasting. There is a role when you can use this. It's not that you don't use that at all. If you want subtle movements, you don't have enough time, I think that is an option, especially for some type of chin. So we always take scan, and then we can suggest the patient if you're a good candidate for a chin augmentation via bony procedure or chin augmentation via a foreign material. I hope that was all right. Yeah.
Yes, sir. Doctor, the following questions are all leading questions from what you answered. But the patients often ask, Doctor, I want to opt for, say, a bony chin augmentation. Now, are there any advantages associated with bony movements when it comes to chin augmentation? A, and B being, also as you mentioned, it's often jaw sculpting is incorporated into the term, say, of genioplasty or a bony chin movement. What does the term jaw sculpting stand for, and how is it helpful?
Well, so I think the advantages I already mentioned. If you're having a functional issue with sleeping or breathing or an obstructive sleep apnea, you have a very short retruded chin, you want movements of 15 millimeters, 20 millimeters, no way you can do that with a foreign material. Secondly, this is lifelong, it's lasting much longer than the foreign material, and when it's your own bone in a new position, also feels nicer. This is what a lot of my patients tell me, because it always gets back to the way they feel. But with this guy in, you can always feel and palpate the chin. So these are the couple of differences. There is a role for everything. I did mention about the filler aspect as well. For chin augmentation, we do have different roles for it. But to say which has more advantage, I think the Bony procedure definitely. Of course, as I mentioned, it's a skill set is different, more difficult to do. I think the learning curve is more. And not only that, you need good instrumentation. So we got to have good striker saws. You got to be sure of the nerve. So there's a little bit different approaches and risks and technical issues, skill sets, finesse, everything involved with the two procedures. Now you also asked me, the last thing was about
the term jaw sculpting.
Yeah, so sculpting is a word I tend to use for want of another word, because just cutting the bone and sliding it forward, as it's often mentioned in literature, doesn't really give the impact for all patients. Because some patients desire a nice straight line, so you got to work a little bit in the jaw, either on the osteotomized segment or in the segment behind. And for a want of word, I use the word sculpting. Also, if you want to get the chin not only forward in both vertical and horizontal dimension, but let's say you're a girl, you're in your 20s, you want to get it more pointy, genioplasty alone doesn't suffice. You have to do some sculpting there. You want to make it more broad, there again. So this is the things I think this jaw sculpting comes into play. When you want to get that precise shape, just a bone cut doesn't suffice. And what that extra thing is this sculpting.
Doctor, here's a patient of ours who's a young boy, a good build, but he has a weak chin. Now he wants this very popular male chin, as we say, or coat. How can he get that? How can chin augmentation help him achieve that?
Yeah, this is also something a lot of our patients are now asking for. They want to have really like a strong Angelina Jolie or a Hrithik Roshan type chin, or even Ramus. So you can use PEEK, a foreign material, but a lot of times we're able to move the existing lower jaw into different positions by making cut in the bone, by moving the cut part either forward, downward, upward, sideways, in order to get the results. And as I mentioned earlier, this is having a longer period of success. This is better because we can do even bigger movements. So I think male chin or a strong personality, many patients, even today we had this patient who came in all the way from Hyderabad and he was just seeking for a strong chin. And so I think that's really in vogue. And we can do up to 15 millimeters, not always, it's not a rule, but I can do up to 15 millimeters mostly without bone grafting. You want to do more than that, sometimes I might have to take some bone, preferably from the iliac crest or from the hip bone, not from the rib. All right, what else do we have?
Doctor, patient asks, say he or she is very much interested in chin augmentation, but will the result be permanent? That's a very commonly asked question.
Yeah, so it is permanent as long as you don't use fillers. If you use fillers, just resorbs after a few months, but both these are permanent forms of chin augmentation for you that we're just discussing all this while.
Also, doctor, would you like to throw some light about the recovery, as in the post-chin augmentation phase?
Yeah, so I did mention a bit during my earlier long talk. So the implant or the silicone or the PEEK or whatever you use, the MedPo, this heals faster. You're not making any bony cut. You're only making a cut in the skin or maybe in the mucosa if you want to do it from inside the mouth. And so it takes about 7 days usually for everything to heal. But when you cut the bone, you have to remember bone takes 4 weeks to heal. This is a minimum period for bone to heal. When you leave a gap in between, as what we do when we do the chin augmentation via the bony osteotomies, it takes longer. Hence, the healing period is much longer. Initial healing is about 7 days for the bony procedure, while otherwise it's about a day or two. And the final healing, that's about 1 week and about a month. So yes, you're looking up at different healing periods based on the procedure you choose.
Okay, so doctor, a patient says that she's a young girl and she has snoring problem. and it's been quite consistent, and she has a receded small chin. Can chin augmentation solve this problem for her?
So obstructive sleep apnea can cause snoring. Snoring has multiple reasons, but one of the reasons for snoring is less airway. So we got to work on these patients, as I mentioned earlier. We're going to work them up. We're going to do an obstructive sleep apnea study, a sleep study. We're going to do a dynamic MRI if needed, CT scans. But one of the most common things that we do in order to solve a sleep apnea is a bimaxillary protrusion or a bimaxillary advancement. That's a much bigger procedure, but just a genioplasty, an extended genioplasty, in literature I think it's called mortise and tenon if I'm right. So that procedure also improves your sleeping, because when you pull this part forward, it pulls the muscles that are attached here, stretches them forward, thus increasing the airway behind, and therefore makes your breathing better. So even if your tongue falls back, it doesn't fall back totally when you're sleeping, and if it doesn't occlude it completely, then you don't get snoring. So that's the relation between genioplasty advancement and snoring. I have to just mention one thing for completion, is that we can also do distraction to get a nice chin. Patients got, let's say, a really Andy gum kind of a deformity, hardly any chin visible, you got to advance it by 35 millimeters for example, you still have a solution. It's not one of these. You do what is called as distraction osteogenesis, because we are a craniofacial center here. We do get kids, we do get adults who have those kind of challenging issues as well. And for those very, very small subset of patients, you could do distraction osteogenesis. We do a lot of them. Distraction osteogenesis basically gets new bone. Their own body creates new bone. It takes longer periods of time. Probably that's for another video, entire topic of distraction and how we can sort out the various issues of the face of the procedure. Are we done with the chin augmentation, or do you have anything else?
The last question is, a patient says about the ongoing debate was of bony chin augmentation versus then chin implant. Have you done something where it's been done concomitantly or both together?
Yes, we have done on a few patients. I've done that as well. In fact, that's with an editor. We've set it up for publication. It's not commonly done, but rarely we do get patients who've already had a chin implant and they want a chin augmentation by the Bony procedure. So sometimes it is possible that I retain the chin implant and do the osteotomy, and sometimes it's possible to do vice versa. That is, if osteotomy has been done, I'm placing the implant, and even sometimes it's possible to put both at the same time. That is, do the osteotomy and put the onlay on top. This is only if you need like a lot of movement. You can get, let's say, 15 millimeters the Bony augmentation, you want another 7-8 millimeters, and then you can obviously use the silicone or the PEEK or whatever as an onlay.
So this sums up most of our questions.
All right,
Thank
so
you.
I hope this chin augmentation video session that we had was useful. I've tried to answer most of the commonly asked queries. I have to mention one more query she hasn't taken down, but I remember now as I speak. It's about the temporary numbness patients do have. Now, it's quite common with both the procedures if it's done from inside the mouth, because you go around the mental nerve and free it. Do remember that unless and until that nerve is not severed totally, you never have a permanent numbness. I keep telling this to my patients that in about 300-400 patients that we do in a year and a half, we rarely get chin numbness for long periods of time, meaning as a permanent complication. But listen carefully, you could have numbness that lasts up to a month. This is because when you make the osteotomy, when we make the advancement, the nerves do get pulled a bit, and therefore it causes numbness in this area alone. The numbness slowly reduces from outwards to inwards, and eventually they start feeling numb. This is something also that a lot of our patients keep asking. So there's no way you can do a nice osteotomy augmentation with no transient or temporary numbness. Very often it's there. It's not bothersome for most patients. A few percentage of patients find it difficult to attend social events, let's say 2 weeks after surgery or 4 weeks after. I think all of that should be settled, even the bruising or the swelling. So thank you. I hope that was useful. We're going to give you our WhatsApp number, and please ask your queries by messages, because our lines are busy all the time. We'll really appreciate if you message us with pictures or comments or recommendations, questions, whatsoever, and we'll be more than happy to get back to you. Thank you. Namaskar.